How does neoadjuvant therapy work for stage 3 colorectal cancer? Imagine facing a diagnosis of stage 3 colorectal cancer, where the cancer has spread to nearby lymph nodes but hasn't yet reached distant organs. One of the key strategies in managing this stage involves something called neoadjuvant therapy. This is treatment given before the main surgical procedure, with the goal of improving the overall outcome. But how exactly does it work? Let's explore. In stage 3 colorectal cancer, the main goal of neoadjuvant therapy is to shrink the tumor and reduce the number of cancer cells in the lymph nodes before surgery. By doing this, doctors aim to make the tumor easier to remove completely and to lower the chance of cancer coming back later. It also helps target microscopic cancer cells that might have spread beyond what scans can detect, which could otherwise lead to recurrence. The most common form of neoadjuvant therapy for colon cancer is chemotherapy. Drugs like FOLFOX, which combines oxaliplatin, leucovorin, and fluorouracil, are often used. Sometimes a more intensive regimen called FOLFIXIRI, which adds irinotecan, is chosen. These treatments work by attacking rapidly dividing cancer cells throughout the body, shrinking tumors in many patients. In some cases, this can lead to downstaging, meaning the cancer appears less advanced at the time of surgery. For example, after neoadjuvant chemotherapy, some patients have fewer cancer-positive lymph nodes, and a very small number may have no detectable cancer left at all, known as a complete pathological response. The treatment is usually given over several cycles before surgery. The number of cycles depends on the patient's overall health and how the tumor responds. Typically, patients might receive 4 to 6 cycles, spaced every 2 weeks. Importantly, research shows that giving chemotherapy before surgery does not usually delay the operation or increase the risk of surgical complications. There are clear benefits to this approach. Shrinking the tumor can make surgery more effective, possibly reducing the extent of surgery needed. It may also help some patients avoid additional treatments after surgery. While ongoing studies are investigating whether neoadjuvant therapy can improve long-term survival, current evidence suggests it can be beneficial in carefully selected patients. Of course, there are risks involved. Side effects from chemotherapy can include fatigue, nausea, lowered blood cell counts, and other issues. These side effects vary from person to person and need to be managed carefully by the healthcare team. The decision to use neoadjuvant therapy is always made after weighing these potential risks against the expected benefits, and it should be tailored to each individual patient. Recently, researchers are also exploring immunotherapy as a neoadjuvant option for certain types of colorectal cancer. These drugs help the immune system recognize and attack cancer cells more effectively. Early results are promising, especially for cancers with specific genetic features like mismatch repair deficiency or microsatellite instability. In some cases, short courses of immunotherapy before surgery have led to high response rates, and in rare instances, patients have been able to avoid surgery altogether. However, this approach is still under investigation and is primarily used within clinical trials for select patients. It's important to remember that not everyone with stage 3 colon cancer is a candidate for neoadjuvant therapy. Factors like tumor location, size, genetic markers, and overall health influence the treatment plan. Currently, the standard approach remains surgery followed by chemotherapy after the operation. As research continues, the role of neoadjuvant therapy is likely to expand, offering new hope for better outcomes. From a colon health perspective, early detection and accurate staging are vital. Neoadjuvant therapy is a promising tool that, when used appropriately, can improve surgical results and reduce the risk of recurrence. Always consult with a healthcare team experienced in colon cancer treatment to understand the best options for your individual case. Remember, each person's journey is unique, and treatment decisions should be personalized based on the latest scientific evidence and your specific health needs.